Good afternoon, everybody. My name is Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome to our first public health conversation of 2022. These events are meant to inform the conversations that shape a healthier world. They are a chance for us to come together as a community, to share ideas, debate, and deepen our understanding of core issues. Thank you for joining today's discussion. This event is the first of our challenging public health series. Our aim with this series is to take a self-examining look at public health efforts over the last 2 years, as we have reckoned with the crisis of COVID-19. During that time, public health made choices based on often incomplete and evolving information. Some of what we did was right, some of what we did fell short of our best. I've written reflections on these efforts and others within public health in our school community. To broaden our reflections, it is helpful to hear from those who work outside of our field. Doing so helps us see public health with fresh eyes, including perhaps the blind spots we ourselves can miss. That is why we have asked some people whose thinking we admire, who work outside of public health, to come talk about their perception of public health over the past 2 years. Building a healthier world, one that can prevent future pandemics, means evaluating our strengths and weaknesses so we can emerge from this moment better able to pursue our mission. We have, with intention in this series, invited thinkers from outside the field, aiming to do better at holding that mirror to ourselves. Today, we have the great privilege of welcoming someone whose work I've long admired and who has long shaped the public conversation around key issues. Rebecca Traister is a writer at large for New York Magazine. A National Magazine Award winner, she has written about women in politics, media, and entertainment from a feminist perspective for the New Republican Salon and has also contributed to The Nation, The New York Observer, The New York Times, and The Washington Post. She's the author of Good and Mad and All the Single Ladies, both New York Times bestsellers, and the award-winning Big Girls Don't Cry. It's now my great privilege to turn the screen over to Rebecca Traister. Rebecca.
Thank you so much, Dean Galea. And I'm really honored and flattered to have been asked to speak. I am very self-conscious about not being an expert in the realm of public health, although it has been explained to me repeatedly that this is part of the point of these conversations. I am a journalist who writes about the worlds of politics and activism from a feminist perspective, with a particular eye to the gendered, racial, and economic inequalities of so many of the issues that confront us. And many of the things that I do cover, from organizing to electoral politics, are obviously directly tied to public health, literally the health of this nation and its people. And so the story I'm going to talk about at the beginning of this hour is the story of the pandemic years and shifts around politics, policy, and activism that I saw happening in my work leading up to the pandemic years and how they shifted over these past couple of years. And the story is pretty grim. I want to give a fair warning going in, but I think it's one that also entails an enormous amount of swift change and promise that it would be a mistake to ignore, even when we're feeling grim about it. So, I have spent years reporting on the efforts by both activists and an increasing number of elected officials to push for the kinds of policies and safety nets, social and economic policy that would mean more people in this country could live healthier lives, physically, economically, mentally, and emotionally. Now, the lists of the kinds of policies I'm talking about, are incredibly long, but they include, access to affordable, high-quality healthcare, including reproductive healthcare, affordable housing, access to safe and reliable schooling, paid family and caregiving leave, higher wages for caregivers, subsidized early education, childcare, and pre-K programs, a serious state investment in a green economy and the address of climate change, the redress of carceral inequality, state brutality, and harmful anti-immigration policies. The gaps in these systems over decades have, of course, been glaring. Black maternal mortality rates have soared. Reproductive health care, while officially legal, has been inaccessible to millions over decades, and especially in poor, rural, Black, brown, and immigrant communities, thanks to draconian state restrictions and to the Hyde Amendment. For decades, we have had a workforce of caregivers that was unable to live on their wages, to feed their families, pay their rent, and a workforce of parents unable to depend on reliable child or elder care. These were systems that in some cases had been gutted or just allowed to corrode, or in many cases had never been meaningfully strengthened by our government, stretching back over 60 years. And each and every one of these issues and systems, from my perspective, is tied to the ability to better ensure healthier and safer lives for more human beings. But because so many of the daily effects were felt perhaps most acutely in communities that have long been marginalized, Black and brown, poorer, rural communities, and because our political media and our politicians too often come from and direct their work toward an imagined economically secure white middle class, and of course to larger corporate interests, there had been too little broad understanding of how widespread this kind of ill health and insecurity was. And of course, the reverse trumpeting about how big government interventions were a bad thing. But in the years directly before the pandemic, the Trump years, really, organizers had actually been making real gains. And this was the part of the work that I was covering, getting traction, making clear that these systems needed repair, needed strengthening. And there was a new generation of elected officials, politicians, who were becoming increasingly vocal themselves about the kinds of changes that the state had to make to better support people. And then the pandemic happened. And of course, it was awful. And so many people were sick and dying and losing their loved ones and fearing for their own health. The mass nature of it shone this unignorable light on exactly why all of these systems and gaps that activists and that handful of politicians had been pointing to for years were so pressing. Millions of people experienced, in many cases only briefly, but often for the first time in their lives, what it felt like to not be sure they could get the health care they needed. Millions lost jobs. They felt the fear of not being able to feed their families or pay their rent. Families at many economic levels lost the ability to send their kids to the schools. Many began to understand the work that caregivers and educators do in a new way. And it was all horrifying, but it was also instructive. And then some remarkable things happened from a policy perspective. The government offered direct financial relief, expanding unemployment benefits, offering small business relief, the pause of student loan payments, in many communities, rent relief and eviction protections. There was miraculously direct money for children in the form of the child tax credit, checks that were sent every month to families, not tax code loopholes. And of course, we witnessed, and many of our families benefited from, one of the swiftest public health interventions, the development of the COVID vaccines and treatments of any of our lifetimes. And these measures had an effect that millions of us could feel. Millions on the left and the right. Whether we were getting enhanced unemployment benefits that enabled us to put food on the table, or child tax credit checks, whether we didn't have to fear eviction briefly or could, for a period, stop worrying about how to pay back student loans, millions of people were able to feel how these kinds of economic and social safety nets, how government intervention and more robust policy could make our life, our health, for our kids, ourselves, our parents, our physical, mental, and emotional health more stable. And so many of these kinds of reforms really actually do have broad support and now lived experience. We know that we are ailing in a society, I think, in a way that we didn't know before. We know to some extent have experienced the need for help from our government, and the pandemic made us see the ways, some of the ways, that we could be helped. People could feel it. And to some extent, at least, I think legislators could feel it and could see it saving at least one thing, which was the economy. It offered a certain kind of blueprint, and not one. I don't want to pretend here that these kinds of interventions fix things. People have been dying. The schools, the school closures, and unequal access to healthcare, unequal distribution of those vaccines, both here and crucially around the world, those remain pressing and grievous inequalities and challenges. But there was this lived model of how policy could materially change lives for the better. And of course, in the midst of this, we elected a president who happened to not be my first choice for president, but who came in promising that he was going to model his term after FDR, and indeed did present a budget that had so many of these programs in it: the child tax credit, paid leave, subsidized daycare, more support for domestic and care workers, green investments. And it did not pass. The government did not make it happen. And the questions of why are very complicated, but they are also not that complicated. Because even as public opinion, even as the stances of some politicians themselves, and even as the circumstances of the pandemic and a growing awareness of climate crises and mental health crises and education crises bear down on us, some of the institutions and systems that we have been taught would respond, or supposed to respond, to shifting public needs, public opinion, and circumstance, have, over this same period of years, been effectively broken or perverted, or in some cases are working in the way they were built to work, which was to preserve power for a minority of people. And I'm talking here about things like the Electoral College, the filibuster, the robbing of Barack Obama of a Supreme Court seat, a Supreme Court where now the majority of justices have been appointed by presidents who were elected by a minority of American voters. It meant that these shifts that seemed to be promised right in front of us, we could see them as possibilities. Not only did they not happen, but so much of the potential was squandered politically, leaving us not just where we were before the pandemic, but to some degree far worse off, because the momentum of those building activist movements has been halted. The elected officials who had been prompted to fight for these shifts have hit walls. We know the Supreme Court is now a 6-3 court, very likely to overturn Roe, but also to make voting, education, labor protections, and healthcare even more inaccessible than they've already been, and make access to guns and the ability to restrict liberty based on religious belief even more accessible. Combined factors, including, and I'm assuming we'll talk about this in the Q&A, a breakdown of public health communications, both coming from officials and filtered through media under both Republican and Democratic presidential administrations. The flooding of the airwaves and the internet with disinformation have replaced what could have been, which had the promise to be a newly reborn trust in government after all those life-saving medical developments and economic relief successes, with rampant distrust, which of course sets it up to be harder to imagine how we make it through the next pandemic, the coming climate calamities, and efforts to unravel our democracy. The kind of aid that was so necessary last year is now being pulled back, with no promise that we'll get more of it. And we have a nation of people who have been sick, scared, and are grieving, a healthcare workforce that has been burnt through and is at its breaking point, caregivers, including teachers and child care workers who are ill, quitting, and have been vilified from multiple sides, children experiencing physical and mental health issues, women emptied out of the workforce in staggering numbers. There is no promise of economic or educational or caretaking support. We do have a population that is still refusing vaccines in large numbers, 2,500 people dying a day at this point. Reproductive and maternal health care already inaccessible in vulnerable communities and about to become more broadly unavailable. It is extremely bleak, and no one is more sorry to be telling the story this way than I am, but I think two things are true, and I want to end on them. One is that I don't think that prettying it up is going to get us anywhere good or useful or more humane. But the second is that just because it's bad, and just because I think we do need to be frank about the costs and losses of this period, I do not think that that should lead us to despair. Because when it comes to the kind of thinking and work that is ahead for so many, despair is poison. It paralyzes us. It makes us think there is no fix, and therefore it's not even worth trying. And that's terrible, because while it is true that there is no easy fix, that actually means we have to try harder than ever before. And we can behave, the positive thing I will say is that we can try harder than we ever have before, because a lot has happened in the past couple of years that has never happened before. We have been changed by this. And yes, the systems at the top that are blocking our ability to enact change, that are pushing us backwards, are powerful and destructive, and there are not easy paths to recourse. But I do believe, and I do believe that we have to be clear-eyed about it, But we have seen the promises and lessons and experiences of the past few years. We understand that as a nation, we must carve a path forward, and that we as a people did just live through calamitous years in which government was able to improve lives via vaccines, medicines, money, safety nets in ways that were tangible to many of us. And part of the fight is to take those experiences, even if they were thwarted politically, most recently, forward to fight, in many cases, perhaps from the margins of power and with limited tools, yes, but for more of what saved so many millions of people. We need to continue that and not let people forget how help came when it did and from whom. And I will close on the fact that this week I have been reading articles about students around the country who are staging these walkouts. And it's very interesting. It's happening in schools around the country where short staffs and rampant COVID spread is leading to kids actually staging their own protests and walking out of school. And it's interesting because there are so many sides on the schools debate. And these kids, they don't want their schools closed. They want in-person learning. But they also don't want unsafe schools. And they can see a middle path. And the middle path is that their schools get the resources that they need, meaning tests, good masks, air filtration systems, investments, so that even if they have to go remote for short periods, there are the kinds of investments in technology and training that can make that better managed. They're demanding those kinds of investments. And that I think, in a funny way, when we're in this stuck period, is a great model for what we can focus on, is that certain kinds of investments and resources really provided help last year, and we need to continue to ask for those resources in the midst of the kinds of fights that we're going to be facing.
Thank you. That was terrific. And as somebody put in the Q&A, it was a thank you for such a complete and passionate analysis, which I really appreciate. I'll just make a note for the audience that if you want to put questions in the Q&A, I will get the questions shortly. It's easier than putting them in the chat. But let me start off, Rebecca. First of all, I thought it was really terrific, and it was a terrific synthesis. And I resonate with a lot of it, given some things which I've written. But let me start with a question I've been meaning to ask you for years, and I'll start with this, which is I thought you're in your book Good and Mad, you talk about the politically transformative power of women's anger. I thought it was a really terrific book. So here's the question: do you think we have been angry about the right things in the COVID moment, and what role does anger play in a data-driven world?
So it's a fascinating question. And when I was writing these remarks, I almost included a line about how, even though I've written about the power of anger, that I think that it might be useful at this point for a lot of people to think about how to convert their anger into demands on the state. So you ask a really provocative and interesting question, because I wrote the book about the power of women's anger 2 years into the Trump administration, and I did write it acknowledging that, in fact, not only anger, but women's anger is deployed. Anger is hugely behind the rise of an intolerant, racist, sexist, violent right wing. Anger is behind the rise of authoritarianism. Anger is also, women's anger, white women's anger was powered the resistance to school integration in the middle of the 20th century, right? It's not that anger or women's anger is an inherent good. But in that book, I was particularly tracking anger between women who have historically been discouraged from expressing their anger as a communicative tool, and in part one of the building blocks for organizing, right, for coming together in coalition. And so it was a book that was largely positive about the power of anger. And I've thought a lot and about the kinds of anger that I've seen in the years since that book's publication, and how anger, even that's being stoked, isn't always productive and isn't always useful. And it's not like that's a newsflash to me, but it makes me wish I could revisit that book and recontextualize it, given the events of the past couple of years. And that doesn't mean that I want to be, somebody recently said to me they were angry about something that I was not, actually related to COVID. They were angry at a teachers union. And that is and it was a woman who said, "See, this is what your book is about." I was like, "Oh, no." But you know, oh, what do we do? And I see the ways. It reminds me a little bit and I implicate myself here when I say this consciously. There was a choice in the reproductive rights movement, as opposed to the reproductive justice movement. A reproductive rights movement at some point a few decades ago decided to use choice as the rubric that they were, right? It was like a euphemism, so people didn't say abortion. And they stuck to choice. And then everything became a choice. And like there's actually like a famous Sex and the City episode where Charlotte says, "I choose my choice, I choose my choice." And her choice was like quitting her job and becoming a full-time wife, right? Where choice could account for everything. And I am working through in my own, I wrote the book about anger, and I'm proud of the book, and I'm proud of the history in the book and the argument that I was making for that moment. But I also think that I did not fully account for the way in which anger and pure expression of anger, and in fact that powerful political forces could just use anger as this all-encompassing thing, that every time we feel angry it's righteous, and that was not the intention of that work. And I think a lot about how I could better recontextualize it going back.
Thank you. I feel like that answer you just gave was a masterclass in evolving thoughts informed by the COVID moments. As I'm hearing you reflect back on your own work and thinking about its how it stands up to time, and particularly through this lens of COVID, and hearing you think that through, it was really an amazing answer. Thank you.
Well, I wish it were more. The problem with that is that when you're thinking things through in real time, I wish I had a cogent. I wish that I had an easier answer. And it's still, these are still things that I am wrestling with in my own head. In the middle of the night, I wrestle with these ideas. So I wish it were a simpler answer.
Well, if there's one thing COVID has taught me, is that anytime we think something's simple, it's actually not. And if we think it's simple, it means we're not thinking hard enough. Let me ask a different kind of question, although building a little bit on sort of some of the emotions perhaps we just talked about. So you've written about the conservative victories in the 1980s, and you've sort of written that they're in part a cultural backlash to progressive gains. And so I guess my question is, how do we engage, and we broadly and we public health specifically, with progressive backlash during the Trump years? And how can we actually work towards a transformative political realignment, recognizing the many emotions that are emerging in the context of emerging from the Trump years and COVID, and to do these kind of things productively towards creating a better world?
Oh, well, it's a tough question, because one thing that the right was great at in their response, and it took a while for them to get going, and it's important to remember, right? But the conservatives, social conservatives suffered, and before that, economic conservatives, there were huge losses suffered by the right in the middle of the 20th century. When it came to economic policy, certainly the disruptions of the civil rights, women's, gay rights movement. And what the right wound up doing was strategizing in a way that kind of takes your breath away when you look at it, and strategizing things that were just sort of, I see pieces now being like, oh, they ran for school boards, right? Like the right began to strategize at a local level, local elections, city council elections, school boards. They began to strategize around the court. I mean, what we are now seeing in a court that is run by choices of the Federalist Society is a decades-long plan by the American right wing to take over the courts and to undo, truly reverse, and we're going to see it happen, reverse the decisions that proved some of their biggest losses in the 20th century, right? Roe is the one that's right up at the plate right now. But it was the Voting Rights Act. It was Shelby in 2013 that was already reversed. It's undoing piece by piece. How did that happen? Was creating a long-term investment in a pipeline of judges. It was also a Republican Party. I mean, they also created a media. The right also, it cannot underestimate the impact of Fox News over decades, and now a right-wing online presence, right? And they had funders for this, right? So there are a million different levels where there was money, there was local organizing, there was really keen strategizing. And one of the issues, this is a real cost benefit thing about wins and losses, because being in a position of fighting for these things, especially when you care deeply about them, it's exhausting, right? And it's hard. And these are the kinds of fights that people who have come before us have given their entire lives fighting for, and have often died before they saw any victory, right? And that's not a fun thing to sign up for. So there's this period where there were these big wins for broadly arrayed, like the left, progressives. And then there was this impulse to say, okay, great, we won. And there was a backing off of some of the energy, right? I think you could see that in a microcosm after Joe Biden's win, right? And it was something that I was hyper aware of and nervous about very recently. The idea that all of these people who were organizing with their every molecule, and that was correct, to get Trump out of office. Then they won, and it was like, woo! Thank God, that was great. And there was no sense, and that's how you get, and I keep using Roe because the Roe was considered the end point and not the starting point, And so from the moment Roe was passed, it was eroded. The passage of the Hyde Amendment meant that government insurance couldn't be used to pay for abortion care, which made it all but illegal for millions of people. And the Hyde Amendment has been in place, and Democrats, until the past 5 years, didn't even object to it. Many voted for the Hyde Amendment. Barack Obama called it a tradition. That's how recently Democrats had been just passive in the face of a law that meant that poor people could not get abortion care as part of their health care, abortion care that was officially legal, right? There was a passivity. And so the election of Trump knocked the passivity out of a lot of people who came from privileged worlds where this was, where the fact that abortion was inaccessible to poor people didn't affect their ability or their family's ability to get abortion, and therefore didn't understand it as imperiled over all these years that it has been. So Trump knocked some urgency into a lot of people. So we have a lot of urgency, and it has to survive the things like Biden winning and then not getting Build Back Better through, it ups and downs. And a lot of people who haven't spent their lifetimes fighting have to get used to what it's like to lose a lot of those fights if you're on the margins of power, right? That's another muscle that needs to be exercised, is how to get back up and go back and fight some more, because that's the only way we move forward, right? But there also has to be better strategizing. There has to be some answer to the right wing's, we're going to have media and we're going to do it on a local level. And there was just a great article about an organization called Run for Something, Amanda Littman's organization, that trains people to run, first-time candidates, to run in local elections all around the country. There are people who are at work on those kinds of things right now. But it's a sort of multi-system approach. There's not one answer. A lot of people who are not used to being in this kind of fight, and who are not used to how awful it is to lose these fights, there's a hunger for what's our path? What do we do? How do we fix it? Well, the answer is there are a million things. You need money, you need organization, you need media, you need, and so there's not one easy answer for that.
Thank you. Let me ask you one more question from me, then I'm going to go to the Q&A from the audience. So a bit of a shift, but something else you've written about. You've written about power, and you've written about how power can veer into abuse. And during the pandemic, public health, which is sort of the world in which we swim here, most of us in this room, found itself in a position that was unaccustomed to, of increased power and authority. So I suppose my question is, how can public health best use its power to support a better world without being corrupted by it? And as public health becomes more entwined with state power, which is what we're seeing right now, how can public health avoid contributing to hierarchies which become oppressive?
That's a terrific and unanswerable question.
Sorry.
How can we get power to not corrupt? I
was hoping you would solve this once and for all.
Well, look, one of the things I am actually optimistic about, and I don't know the world of public health well enough to know how applicable it is, but one of the things that I see, for example, in electoral politics, and I don't want to tell an easy fairy tale version of this, but the way power has been structured in this country over centuries has been on a white patriarchal capitalist, not to use like activist buzzwords, but there's no other way to describe these things, right? A white patriarchal capitalist framework, right? Of top-down power, lots of people at the margins, groups divided, and that is in some realms, as there have been incursions from people at the margins into systems, right? There's the scenario where the people who've been on the outside of those systems come in and then just get corrupted and start abusing in the same, like adopt to the model, right? But there are also a lot of, I am somewhat optimistic about the idea that there are a lot of impulses to change how power works. And I think that the stuff I was talking about in my remarks about how you could feel those things shifting, some of the approaches of elected officials, and I don't want to hold anybody up as I'm not a big believer in the heroism of an individual politician, but we know that there have been a group and a generation of politicians who have come not through traditional routes, who gain their power more from their communities and their constituents, and who are acting on behalf of those constituents in ways that for a long time at least had not really been a norm in government. And you see, and I think that when you have, I'm sure, I am confident to some degree, I know people who are in public health right now in this period because they want to see power distributed more equally, right? And it's about, in part, constantly asking, why do I want the power? Do I want the power for power's sake, or do I want it because I want to disperse it? Because I want to take the whatever abilities it gives me or the people I'm here representing to make it work better for more people, right? Is power supposed to work for those who are at the top of the structure that offers it, or is it supposed to work to distribute it outward? Right? And I think that especially there's a lot that we can learn from historical models, but we also have to understand that we are, especially given our climate, we are, and the current vastly unequal spread of enormous wealth and everything else, right? We are in a position where a generation of people who are either already working in all kinds of realms, public health, politics, activism, social sciences, in academia, you have a generation that is hyper aware of mass vulnerability. And the question is, what is the responsibility to the vulnerable for those who can move into positions of power? And I want to believe that that though there were sort of 50 or 70 years in this country where a white middle class that still had a real grip on power was asleep to a lot of inequalities, I want to believe that the very rude awakening that a lot of people have gotten over the past 6 years is not just going to be forgotten. That the undeniable visibility of inequality, suffering, and harm that we've seen and in many cases experienced is going to push at least some percentage of the people who get into positions of power to want to use that power to make more people more secure and not just themselves.
Thank you. Actually, I thought it was a very helpful answer. It actually really helped sort out sort of why one achieves power and its uses. Thank you. Let me go to a question from everybody else in the room. There's a question I'm going to synthesize. I think Sally and Nicole are both asking a similar question. Can you talk a little bit about the unique contributions that you feel journalists have made or can make in a moment like this. And I'll nest that a little bit. I'm just drawing from some of the other questioners in the context that we've had trouble with information, with misinformation. And so where is the role of journalists, and how can public health intersect with the role of journalists in a moment like this and going forward?
So I'm going to give a positive answer about that, and also offer some negativity about it, because I think that the role of journalists is crucially important. I mean, sort of in providing, in telling stories responsibly, right? I am not a journalist who believes in objectivity. I think objectivity is fundamentally impossible in any kind of storytelling. But what you do when you have good journalism is a commitment to telling stories that are as close to true as you can tell them, and to tell them responsibly, to make sure there's information out there, to make sure that science is reported accurately. But that includes, and here's where I would turn to a lot of different directions this could go. The question of how that works to combat disinformation is an incredibly tricky one, because the level and the power of disinformation that's out there right now, as we know, we look around us and see a world in which there is simply not an agreed upon set of facts. And I think that one of the challenges in front of journalists is to combat that confusion by clinging to certainty too much. So this is one of the patterns I've seen during the pandemic, and I really hope I can make this clear, because it's a dynamic I'm sort of obsessed with. And I think in the response to this confusing and maddening clash between disinformation and journalism, combined with certain ways in which my industry rewards certainty, right? I have written before. I sometimes go on cable news, and I have a very clear memory of pre-pandemic being asked a question about like how an election was going to go the next day, a primary, and I said I don't know, and I was actually, like, Rachel Maddow sort of made a joke about how I said I don't know, because you're not supposed to say you don't know on cable news, right? There's a reward system in place amongst journalists, amongst pundits, and on Twitter for being sure, for having the answer. And it's the rise of data journalism. And I care very much about data. I care very much about science. I care very much about facts and numbers and all those things, right? I'm not denying the importance of those things. But when we use those things and combine them with the sort of reward structure for like having a really authoritative tweet or social media presence that says, this is the answer, and you combine that with the kind of impulse to say, no, all those lies you're reading on Facebook, they're wrong, this is the right answer. What you get is a kind of fetishization of certainty that I actually think has been harmful during this pandemic, because everybody's trying to persuade a public that their information is the right information, and that there's this sense that if you can just say it with enough certainty, with enough gumption, yes, I've got it, this is the answer, then that's going to be the persuasive thing. And I don't actually know if that is, maybe it is more, maybe people, I don't know if that works or not, but it has created trouble in how public health issues have been communicated. The early messages about masking, for example, right? It wasn't simply, and to me, I was so sympathetic to this, you opened today by saying, we're always responding to new information, right? The scientists, the doctors, the people I trust most in my life, like with my kids, with my health, are the doctors who will say, I'm not sure what this is, but I think here, this, and this. I tend to believe people who will open with, I'm not sure, or I don't know, but here's the information I can give you. But there, in the media and in journalism, that has become unsatisfying in some way. And so with the masking messaging, my memories of it, and people here may remember it very differently, is that it was masks don't help, right? Rather than what was true, which was A, we don't actually know yet exactly what's going on, and B, we do know that healthcare workers desperately need masks, and we don't want there to be a run on masks and a shortage, right? And those things couldn't actually just be communicated clearly, it came out as a kind of certainty. Masks don't work. Well, that then in turn seeds rampant distrust when we learn that in fact masks do work very well, right? But that's not what we were told. Now, is that the fault of public health officials? Is it the fault of journalists who were seeking the story and trying to get right and pushing for some definitive that perhaps didn't exist? Is it the fault of a technological marketplace that overvalues pithy, single sentence statements of fact over nuance and complexity? I don't think there's one direction to point a finger, but I do think that journalists play a role in that mix of factors as much as anybody else. I know that there is a reward structure out there. I know as a journalist. I am asked all the time, what's the answer? What is the correct choice? And often there's not one. But that's not rewarded in my business. And I think that's something that we have to be aware of as we consume media and journalism.
The idea of false certitude and how false certitude has intersected with the messaging around the pandemic, and how what you call sort of technologically driven media, sort of broadly in the realm of social media, has contributed to that. I just think it's such an interesting set of questions that one needs to unravel. And I think we need distance from the moment to unravel them.
I also want to say it's very natural to want certainty, right? And I think it's not so separate from issues of our health, our mental and emotional health. We are scared. This has been a period when many of us have felt tremendous fear. And when that fear started for us, I mean, I think is different for everybody, right? But there are millions of people, especially those who had previously had relatively economically, socially secure existences, right? Who had been buffered from forms of injustice and inequality and harm, and suddenly felt true fear about the democracy, fear, whether that about policy, about politics, then about disease, about their health, about their personal finances, about the storms that come out of nowhere that we can't predict, right? That there's so much fear that people feel right now. And in many cases in populations that don't have a lot of practice feeling that level of instability and fear. And certainty feels like a protection. It feels like a path. And so we crave it. And that's why there's a reward structure for it, right? It makes sense psychologically, right? We want to be told that there's an answer, that there's a strategy. Even if we are smart enough to know it's not going to be okay, right? We want to be told, well, here's how you do it. It's like you go to the, to Wirecutter to get like the best toaster. Like you need the best answer for how to move forward. Even when we talk about something like your question about strategizing and how do progressives react in this moment, right? There's such a hunger from so many people to like get the playbook. Like, what do we do? Well, I don't know. I don't know. We make it up. We look and see. We think hard about what's happened in the past and what our circumstances are now and what our resources are and who we're trying to represent and what each of us can do, and then we try to put one foot in front of the other. But I think that market for certainty is born of fear, and fear makes people uncomfortable. We don't want to feel fear. And so we will pay for someone to tell us something that sounds sure so we can sleep at night.
Thank you. I'm not sure I had connected the false certitude with fear and with reassurance in the past. That's really, really interesting connection. Thank you. Let me ask a slightly different question, although builds a little bit off this. This is from Doris. I'm just going to modify the question a little bit. And you talked a bit in your presentation about how the COVID moment has surfaced issues of health inequities that have been deep and long-seated decades and centuries, but they've really surfaced them for more than we've ever done before. And that the issues of inequities broadly have now become part of the public conversation. The question is this: what messaging do you think would move people, particularly white people, to see their connection to historically marginalized groups of people and their manipulation by other white people, in this case, people in position of power, who have strong economic and social power?
You mean what works to get white people to care?
What might work? I presume you're going to say, I don't know, but what might work?
I have such a depressing answer to this.
Okay, we can make a pause for a depressing answer, then we'll move to a hopeful answer after this one.
Bad things have to happen to the white people themselves. I mean, and that's one of the reasons that COVID was an instructive moment. It's one of the reasons that the election of Trump was instructed. I mean, there's a reason so much of my reporting and a lot of what I did write about in Good and Mad was the activation of white suburban women to become politically active with tremendous resources, power, and election altering power that they had once they started organizing after Trump, right? But the way that those suburban white women who had not previously cared, and many of them wound up actually, once they began to be activated, genuinely curious about not just their own oppression, but the way that they themselves have been oppressors, right? There's a way that we can be very cynical about that population. And there's also a way in which I'm not cynical, because I have reported on so many people who had been politically inactive and then not only became politically active after Trump, but got an entire education, not just about their own role in terms of power abuse and the way that they had abused their own power. But that all happened because Hillary Clinton got beaten, right? It was when a woman who they assumed had the kind of power that they were used to, it turned out that she didn't, right? There were a number of, it was Christine Blasey Ford not being believed, a white upper middle class woman with advanced degrees whose testimony was actually believed but just overridden, right? It was Heather Heyer, a white woman who was killed by police. These are the sort of among the data points that pulled in a population of middle-class white women into being politically engaged and really active. And that is a version of what I was saying about COVID. It was having people who had been able to rely on government systems, like on government supported systems, and also on their own things that their own money had provided for them, right? Had been able to not think all the time about how to pay rent or their student loans or like who was going to care for their kids or their elderly relatives, right? Or had not had to think about healthcare. Although so many people have to think about paying for healthcare, that's a little different. But who suddenly were plunged into this state that millions of people experience all the time, right? I think so often now, as I read stories about middle-class people and the truly like crushing childcare realities with school closures and daycare closures and working from home and all that, I think all the time about the story of the woman, I can't remember what year it was, but who was arrested for leaving her child at a park while she went to interview for a job at McDonald's, right? Because she was interviewing for a job and there was no childcare. And so she left her kid outside while she went to a job interview and was arrested, right? The reality of not being able to afford childcare in this country, that there is no subsidized and reliable system whereby people can trust, and of course this falls disproportionately on women, that has been a reality for so long. But this experience has made people who'd never had to worry about that reality because they had the resources to actually fix the problem for themselves and their families. But suddenly when those resources couldn't fix the problem, it made millions of people aware of how bad this problem was.
Thank you. Let me ask you a different question. This one is from Leonard. It's a long question, so I'm going to summarize it. The point Leonard is making is that currently what passes as conservatism it's really right-wing extremism, and that really the goal of a fair bit of right-wing politics in the country right now is simply to oppose and undo progressive programs. So the question is, given that, although we talk a lot about federal action, Is this a moment where we say we should shift our efforts away from federal programming to the states? And the example, Leonard uses the example of Roe, which you brought up a couple of times, that when Roe is struck down, women in Massachusetts, New York, California will not really notice a difference, but women in Texas will notice a big difference. And of course, realistically, that says that maybe we should be focusing on the states. I'm curious about your thoughts on that.
Well, that's very interesting. So I want to point out that that is the assumption, and that is what will immediately happen. But that's not all that could happen, because in fact, the right is only a majority away from actually enacting a ban that a federal abortion ban, right? So there's the court, there's Roe going down, and states that have in place abortion protections, and the sort of return to the state patchwork system that existed before Roe. So yes, that is what would immediately happen. But if the Republican Party, and especially, as Leonard points out, the far-right extremist wing of that party, gained House and Senate majorities and the White House, there could be an abortion ban. And that's something that I think not enough people have grappled with. And again, it speaks to that kind of like, oh, okay, certain numbers of people will say, okay, it'll be okay, there'll be systems, whatever. It's not necessarily the case. Secondly, the bigger issue is absolutely we should be talking about states. Absolutely we should be talking about states. It's states where so many of these, first of all, state politics, the building of state organizing and party infrastructure, door knocking, registration, right? There's a lot of things that can, there's this feeling like we can't combat redistricting, gerrymandering, disenfranchisement. Okay, but we have to, so we got to figure out how, right? And you can look at a state like Georgia, right? For 10 years, as a reporter, I first began to talk to Stacey Abrams about Georgia as a state where that kind of investment in people, in voter registration, in reaching communities that have been underserved by political parties, including Democrats. I mean, Democrats, underserved communities who've never been reached by anybody who wanted to actually bring them into the electoral process. That is what people like Stacey Abrams and LaTosha Brown and other activists in Georgia and elsewhere have been doing on a state level that can change state politics, right? Stacey Abrams has been saying for 10 years that Georgia would turn blue, and Georgia did turn blue in 2020 against every prediction, and then elected two Democratic senators against every prediction, right? So there are a million ways, and states also can create those state policies that can protect against, up to a point, can protect people and offer them, there can be their state level child tax credits, all the stuff we're talking about. It's cities, communities that have raised minimum wages, that have done eviction protections and rent relief, right? They're all, it's not just state, it's local people too. But then when you build state parties, you can also then have an impact on federal elections, right? So the building of state parties and state activism and the enfranchisement of people and the commitment to getting people out to vote, to participate, to care, making sure they understand that if they change their governments at local and state levels, it can materially change their lives and their communities' lives as well. That is crucial, because then if you build that kind of infrastructure, then you can wind up shifting who you elect to House seats and to Senate seats as well, which of course can in turn shift federal policy. But you also have to understand that those kinds of investments do happen over decades of work, and that they entail a lot of losing, especially when you have a structural deck stacked against you, as you do the kind of stuff I'm describing. The courts, I mean, the best thing I can say about Joe Biden's administration is that he has actually appointed so many judges, because the state laws matter, not just in terms of who's in the state legislatures or who's going to the House and the Senate, right? It also matters in terms of state courts. And the legal system in this country, actually, this is one thing that Biden's been very successful at, is he has federal courts. He's appointed more judges than I can't remember what the last president who appointed this many judges were. Trump appointed a lot. But That's been crucial because you have all these different systems. It's not just a presidential election. It's not just these federal elections. It is community, state, and judicial elections that matter as well.
Let me build on that and maybe ask a last question before I can ask you to sort of give us any last thoughts. But it's not just federal, it's not just state, it's not just the judiciary, it's also not just politics, it's also culture. And you've written about this. You've written quite a bit about culture. So what do you think? What do you think are our key priorities in trying to shift in the culture, assuming that politics being downstream of culture will then shift with it? Because we've talked a lot about tackling the politics and tackling the legislative branch, but how about culture itself? What should we be tackling in culture?
That's a tough question. I mean, I think that we do tackle a lot of these. I do think that we culturally, interesting question. I mean, we're more fragmented culturally, obviously, than we ever have been before, right? You can be in your own niche of culture and never get touched by other corners where things are changing rapidly. Um, uh, I do think that, gosh, culturally, it's such an interesting question because it can mean so many things. Is it the books that are being published? Is it Hollywood? What is, is it the internet itself? Is it gaming? Is it, and I think that one of the interesting things is that I think given the technological differences between younger people and older people and the way that culture is disseminated via technology, you're going to see a younger generation. I'm 46, it's younger people who are going to be like, older people are going to drop off in terms of controlling our culture and the ways in which we communicate with each other. And those young people are going to come, I think, again, I'm going to be optimistic here, even though there are lots of reasons not to be. This sort of same thing I said about the future of public health. You have generations of people who are growing up fearing for the future of the planet, who have now grown up, had their childhoods and their young adulthoods perverted and shaped by the past 2 years of having missed school. And there's a lot of talk about the kind of costs of that for those kids, and they're very real. But I would also say that those kids are changed by that in a way that is going to shift the way that they produce culture, that we're all going to wind up, being learning from and being informed by, because these kids are growing into a world in which they're going to be the people who determine what we talk about, what we watch, what we read, and how we read. And they have been raised in a world that came as a big shock to many of us as adults. And these are kids who've been shaped by that world. And so I don't think I'm even in the position to answer questions about culture change with any authority, because I think I'm not going to be the one making the crucial changes in coming years when it comes to cultural shifts. And I do think that when I consider the messages that were out there for me as a young person raised in a pretty progressive world, and I consider the differences between what I was taught about racial, economic inequity, gendered inequality, identity itself, the relationship between economic inequality and identity. There's no comparison between what I was taught and never taught versus what my children absorb every day around them from their peers and even the sort of crap television that they watch. So I think that culture is changing more quickly than we can probably even account from, at least me, from my 46-year-old perspective.
Thank you. 30 seconds. I want to make sure you get the last word. Any last messages you want to leave us with?
The only message I want to leave us with is for those of you, and I did see some questions about, like, gosh, how do we, this thing, how do we keep it going? How do we stay in a fight? And I think the thing to remember is that has always been the work of this country, right? This country began and was built on grievous inequity, and it has been a centuries-long project to try to claw a little closer to equality. And there was a period in which there was this false sense of like, we did it, we got a lot closer. And it was never real, it was illusory. But okay, we know that now. It's our job to be part of a very long legacy of people who gave a lot of their lives and a lot of their energy to fights that didn't produce quick results, but that ultimately got us somewhere better. And that's our work going forward. And that no matter how terrifying it feels, and it is terrifying for all kinds of good reasons, it is depressing for all kinds of good reasons, but that's not a reason to not keep fighting. It's a reason to keep fighting.
Well, that seems to me like a suitably hopeful, perfect last words. Thank you. Thank you for a terrific presentation. Thank you for a really interesting Q&A, and thank you for engaging with us. And thank you for everything you do, everything you write, everything you teach us. It's really a privilege to have this conversation. You have a good rest of the day. Take good care.
It's a real pleasure to be here.
Thank you, everybody, for joining us. Everybody have a good afternoon.